Good morning, everybody. Good afternoon, good evening to many. My name is Bethany Caruso, and I'm an assistant professor of global health at Emory University. And I'm happy to be with you today to discuss gender and WASH, measuring what matters, along with my colleague, Sheila Sineroy, who's also an assistant professor in the global health department at Emory. And this work represents efforts from numerous partners, including a primary partner of ours, Athena Infonomics. So the project I'll be talking with you about today is called MUSE, which stands for Measuring Urban Sanitation and Empowerment. The primary goal of this work is to both create and validate survey tools and measures of women's sanitation related empowerment in urban areas. And this is primarily to enable us to design programs and then to monitor and evaluate programs. Now, there are varied and many definitions of empowerment, different conceptualizations of empowerment as well. For the purpose of this work, we leverage the work carried out by the Amsterdam Royal Tropical Institute, or KIT, who define empowerment as the expansion of choice and the strengthening of voice through the transformation of power relations, so women and girls have more control over their lives and futures. And they have also come up with a conceptual model, which is shown here. And you'll see the red right at the center is the domain of agency, with subdomains that include decision-making, collective action, and leadership, which is a primary focus of this conversation today. There are two other domains of prominence, including resources, which includes bodily integrity, safety, health, critical consciousness, and assets such as time or health, time and knowledge, and financial and reproductive assets. It's important to note that the authors indicate that the transformation of power relations occurs through women and girls exercising agency and taking action through the redistribution of these resources towards women and girls, and through shifting of these institutional structures that shape women and girls' choice and voice, and ultimately their lives and futures. So why is it important to measure empowerment, and why for practitioners? Well, here are a few key reasons. The first is that when we measure empowerment, we can actually illuminate gender differences between populations or even across geographies, like neighborhoods or cities. And when we do this, we can figure out what populations or areas that we might want to prioritize in work. We can also understand what domains or subdomains of empowerment might be particularly weak or particularly strong. And when we know this information, we can identify which aspects of empowerment to focus on in order to try and strengthen. Additionally, we can use tools to evaluate program impact. We can incorporate tools before and after a program to see if a program resulted in change. And we can also assess change over time and across program and non-program areas. And it's important to note that measuring empowerment is challenging, not just in the WASH sector, but in any sector. It's been known to be something particularly challenging because it's considered not only an outcome, but also a process. And it's also filled with latent ideas and constructs and not necessarily concepts that are easily observable and measured. So testing and validating measures to ensure that they're rigorous and valid is really important. Which leads to, why is validity important? So validity is the degree to which an instrument or a scale or a measure measures what it's actually supposed to be measuring. So if you see on these figures here, we can actually see in the first image a measure that might be reliable. It might be measuring the same thing over time, but it's not valid because it's not necessarily getting central to what we want to look at. The next image in the middle shows that a measure might not be measuring anything valid in a valid way or a reliable way. It might be measuring something different every single time. What we want to get at is a measure that's both valid and reliable, something that's measuring what it's supposed to be measuring, so on target, and it's actually doing so consistently every time we use it. And that's really important if we want to measure something like empowerment, which is a process and can change over time. Now, in order to inform this work, we carried out a literature review. We identified 257 articles, and this has resulted in the most extensive gender and WASH review to date. And we have the citation at the bottom so that it's available for people to look at. What we found is that the various domains and subdomains of empowerment are extensively reported, and yet we have many negative impacts on women and girls that are also reported, but also under-addressed. We also found that there are very limited measures to assess empowerment, strengthening our understanding that there is a need to improve measurement, monitoring, and reporting to enable assessment of change in empowerment over time. And then really importantly, initiatives were lacking. We found very few studies assessing programs that aim to actually address, challenge, and transform the structures and constraints related to women and girls' agency and resources. And so therefore, we see a major opportunity to create measures and hopefully enable change. So this lit review informed the Muse measurement creation process, which I will now explain. The first phase of this process involved the scale development. So this involved creating items for these measures, much informed by the literature review. And this also involved expert review from external partners, as well as cognitive interviews. Next, we carried out further cognitive interviews and collected data in 2 cities, one in India and one in Uganda, and then carried out statistical analysis to assess the validity and reliability. And finally, we carried out a further validation, well, we're still carrying out further validation of these tools in additional cities in Bangladesh, in the same cities in India and Uganda, as well as additional cities in India, as well as Senegal and Zambia. And we're doing further analysis to ensure that is valid and reliable across these settings. I'm now going to turn it over to my colleague, Klaesener-Metzner, who's going to talk to you about some of our findings.
Thank you, Bethany. I'll move into the results now. And as Bethany mentioned, we collected data in phase 2 in 2 cities. And so I'm going to focus on the results from those 2 cities, Tiruchirappalli in India and Kampala in Uganda, because that's where we have the completed, where we've completed analysis. And as Bethany mentioned, we are now in phase 3 where we are collecting new data, but we're going to focus on phase 2, results from phase 2. So what you're seeing here, and this will be consistent throughout the results slides, is 2 sets of results. Trichy will always be in blue and Kampala will always be in pink or red. And so our survey starts with some, of course, demographic questions and questions about sanitation related behaviors and practices, access to toilets, latrines, etc. And so this first slide is showing the type of sanitation facility that was most commonly used for defecation by women who responded to our survey. And so even with these basic sanitation access questions, we see differences where in Trichy, the majority of respondents used private toilets, and in Kampala, the majority of respondents used shared toilets. We then asked about the characteristics of the sanitation facility or location that the women use. And again, we see differences between cities in the characteristics. So for example, in Kampala, just over half of the respondents said that 5 or more households use the same sanitation location that they use, compared to 20% in Trichy. Whereas in Trichy, the percentage was higher of women saying that they walk 5 or more minutes to a sanitation location. Again, differences, over half of women in Kampala said that they carry water to their sanitation location, and also that they usually have to wait at their sanitation location. Whereas those percentages were less than 20% in Trichy for both of those. And finally, in Trichy, over half of women said that their sanitation location was not located in a private place. And so this is different from having privacy features such as locks, walls, a roof. This is referring to the location of the actual latrine or toilet whether it's perhaps by a busy roadside, next to a house where people are constantly coming and going. And this could be a good or a bad thing. The location, if it's very private, it can also be isolated, which could create different sorts of challenges. But we thought this was an interesting observation from those cities. So moving into the scale validation results, we were able to validate 16 scales and 6 indices. And so the 16 scales are listed here by domain. And so you can see that for each domain, we have subdomains and we have independent scales that are standalone survey instruments for each of those subdomains. And then we also have 6 indices that are indicated by the black dot next to some of the scales. And just to clarify the jargon, scales and indices are considered to be different in the sense that a scale measures a latent construct, something that is intangible, not directly observable, whereas an index measures people's actual experiences. And so we have both for some subdomains. We also have items or survey questions specific to menstruation, which are not included in the scales because we want the scales to be applicable to all respondents. And of course, not all respondents would be menstruating. So we have these as additional optional add-ons to the survey, but they're not directly part of the scale. And so what are we talking about when we talk about our scales? I'll just walk through one example. And of course, we're going to focus on the leadership example since that's what we're talking about today. So we define our definition for leadership is women's expressed support for and belief in female leadership for sanitation-related initiatives. So for each of our scale, the definition is focused on sanitation because that was the purpose of our project. And so within our scale, we have items or survey questions that through the statistical analysis that we did for the validation, they loaded onto factors. And again, that's a bit of jargon, just indicating that the survey questions, we were able to see from the analysis that the survey questions were capturing different concepts or subconstructs of the subdomain, so subconstructs here of leadership. And the first one of those was the subconstruct of support for women's leadership. And there were 3 items or 3 survey questions that loaded onto that factor. An example of one of those was, women in my community should support women's leadership in sanitation organizations. The other concept or subconstruct that came up was belief in women's ability to lead. And there were 4 items or 4 survey questions that loaded onto that factor. An example of one was women are as capable as men to take on official leadership roles in sanitation initiatives. So altogether, there are 7 survey questions or 7 items that that make up this scale. All 7 have the same response options, ranging from strongly disagree to strongly agree. And with those 7 questions, we can calculate a mean score for the scale. And so again, you're seeing results for Trichy and Kampala where they had very similar scores, indicating fairly high support for and belief in female leadership in both cities. However, we also, from the index, could see that women's actual experience with leadership was quite low. And so you're seeing here questions from the leadership index. On the left is whether women were involved in any community group that addresses sanitation issues. And on the right, whether they have an elected or appointed leadership position in such a group. And so we're seeing in both cities that the percentages of women who are saying yes to these questions are very, very low. So we're seeing that women had high support for other women's leadership, but low actual experience of leadership. So this indicates that there's an opportunity, right, for women's leadership to grow. And we did expect low responses to these index questions because this was a random sample of women from neighborhoods in each city. It was not targeted to women who had participated in WASH programs or anything like that. So this was a random sample. And so not surprising, but still indicates an opportunity for women's leadership to grow. We also just quickly saw that there was that there were differences in women's participation, their actual experience of decision-making. So what you're seeing here is women's reported decision-making at the household level and at the community level. And so you see a range of participation from leadership, community decision-making, and household decision-making. There's a range of experiences being reported. So just to quickly wrap up, the implications for WASH programs from our research, we want to really emphasize that rigorous measurement of empowerment is challenging, but not impossible. There are now validated instruments available, and we really encourage WASH programs to consider measuring empowerment as part of their work. Our scales are available, as I said, to be used alone or together in any combination. And we've really tried to design them to be practical and adaptable for implementers. And as Bethany said, data on empowerment and sanitation can be used in a number of ways to inform program design, monitoring, and evaluation, to identify opportunities to increase programs' impact, to allow for continuous adaptation and program improvement, and to evaluate impacts of interventions. Still, there are many, many gaps in the evidence related to gender and urban sanitation. And so again, we encourage everyone to start measuring empowerment and to contribute to the evidence base related to gender and empowerment in WASH. I want to finish by thanking our funder, the Bill and Melinda Gates Foundation, as well as our partners, especially Athena Infonomics, and all of the many other partners and participants who have contributed to this work. Thank you.
Namaste, good morning and good afternoon to all from different countries. I am Meena Shrestha, Joint Secretary from Ministry of Water Supply. Today I am very happy to be here with you as a panelist in this webinar. First of all, I would like to thank Sheila for her research on measuring urban sanitation, and women's empowerment. Actually, she already presented his research, methodology, and results and acknowledgement very briefly. The data she presented is, I'm not sure whether it is accurate or not. Maybe due to time constraint, there are so many comments and suggestions on her. Today, actually, I want to put our initiative started by Government of Nepal in WASH sector for empowering women in WASH. In Nepal, we have two policies for WASH project implementation. One is rural water supply and sanitation policy sector policy. Another is urban water supply and sanitation sector policy. In those policies, there is consideration about gender and especially women. When in Nepal, we implement the water supply and sanitation projects, it is compulsory in water users and sanitation committee to be 33% women has to be there in water users and sanitation committees. Similarly, now in Nepal, in federal context, we have a new constitution. In that constitution also, WAS is addressed as fundamental human rights of people. All the people has to have access to safe water and clean environment. So which is fundamental human rights in Constitution of Nepal. In Nepal, there are some projects, ADB funded projects, urban water supply and sanitation projects. In that projects, during the agreement with ADB, there is a provision of making it compulsory the women's participation during operation of the water supply system, construction of water supply system. Even in the construction, labor contribution, 15% of women has to be involved in during the construction of wash facilities. Similarly, in public toilet construction, the toilets has to be gender friendly, disabled friendly, and women friendly. There are laws, rules, and guidelines to make the women's involvement. And for empowerment, there are some of the guidelines and policies. Only thing is policy implementation is difficult. I think not only in Nepal, but also in other countries, there may be some policies and laws and regulations for women's empowerment, but sometimes in some places, there is unavailability of capable women in decision making. There are very, very few women in leadership, WAS leadership in Nepal. Because of that, in government of Nepal has incorporated some policy provisions. For example, we have Civil Servant Act. In that Civil Servant Act, some of the seats are reserved for women for access to public service. So women's empowerment is very, very important in the country. In Nepal, not only in Nepal, in all South Asian countries, in my feeling, we need women's empowerment. WAS is important everywhere for everyone and anytime, every time. If we can empower gender or women in WAS, we can incorporate women's empowerment in every sector, because WAS is, we need WAS facilities in every sector, everywhere. So that today, I feel is Sheila has initiated good job without measurement, without measurement, correction and policy formulation is difficult and improvement is difficult. After measuring the status of the women's empowerment in WAS, we can change some policies and guidelines to achieve SDG goals. As per the SDG goal, we have to achieve safe water and sanitation for all by 2030. To achieve that SDG goal, Government of Nepal, especially Ministry of Water Supply, has developed one MIS system to measure unreached population, not only women, but also poor and marginalized group. Because during the project planning and budgeting, without knowing the unreached population and unreached area, planning is difficult and budgeting is difficult to achieve SDG goal by 2030. So in Nepal, we have started to prepare WAS plan, water supply, sanitation, and hygiene plan of all the 753 local municipalities.
First of all, thank you, Nicole, for giving us the opportunity to give our part of presentation and also share our experiences and learnings as far as a country we are concerned on SDG6. I will be very brief and quick about the outline of presentation, that how the global scenarios and the country context are, what do we have as a policy instrument, and how we are transforming those policies into actions. So there are a few areas of interventions which I will be discussing in detail. So very briefly, as we all know that there are a number of reports globally that have already projected that how much poor water sanitation and water shortages are affecting people. So at least 1 in 4 people will suffer by 2050 with recurring water shortages. And 2015 report of UNDP clearly reflects that there are almost 4.5 billion people who lacked safely managed sanitation services, and 2.3 billion are lacking even the basic sanitation as well. And the situation is not different in Pakistan as well. So we also are currently, as well as the country context is concerned. Please move to the next slide. Country context is concerned for the access to safe drinking water. Nicole, can you move to next slide? Nicole, can you move?
I'm trying. It's really
no issues.
There we go.
So very briefly, I would like to share a brief country context as far as the access to safe drinking water and access to safe sanitation is concerned in Pakistan. So for access to safe drinking water, the baseline target set in 2017 was 36%, but now at this point in time, we are at 39%. So 2021 reports reflect that access to safe drinking water is 39%, and the projections show that if we go at the same pace, by 2030 we will be reaching to 50% access to safe drinking water target, which is much below the set ambitions and targets as far as SDG targets are concerned for access to safe drinking water. And same goes to say access to safe sanitation. Our baseline target, our baseline was 0 in 2017, but then we worked upon the definitions, and now the baseline is at almost 40% of the population. They have access to safe sanitation, because considering that they are treating, some kind of treatment is available at the household level because of the septic tanks which are available in some of the households. So this is the current status. But now looking at that, the situation, although although we are improving gradually and slowly, but looking at the gender context, there is a lot need to be done, because if you see that as per the latest census, our population is almost 207 million, and almost 50% of them are women. And Pakistan being among the low income countries, women and girls have the primary responsibility for the management of household water supply, sanitation, as well as taking care of health of the household and individuals as well. Now addressing to the needs of female in relation to water, sanitation, and hygiene, that is considered as one of the key drivers in achieving gender equity, and as well as locking the potential of half of the global, half of the society within Pakistan as well. So we are understanding and considering that this is one of the area that is actually being affecting the gender context in Pakistan as well. So what we have in hand, obviously, what we have to do while implementing the interventions for SDG6 reporting, and also in achieving the targets for SDG6, requires us to have kind of a policy backing. So we have three policies. One is the drinking water policy, then the sanitation policy. Sorry, it's not a draft, it's final approved policies. There's a typo. And then national climate change policy. All of the policies are there, and there are in all of the policies, they are reflecting well on the gender context, on the gender context of the water and sanitation as well as the climate change policy is addressing the cross linkages of SDG6 with SDG13 as well. So, and as well as addressing the gender component as well. But you know, the policies are not the only way to actually address the progress on SDGs. So there are strategies and plans that are supporting these policies to achieve those gender segregated targets that are being recommended within the policy recommendations. So this includes, there's a behavior change communication strategy for WASH that is being developed by the Ministry of Climate Change, obviously with the support of our stakeholders. A few of the stakeholders like WaterAid and UNICEF, they have supported this strategy, and it has clearly reflected on that without including or interventions related to gender, we cannot achieve the results which we are mentioning in our policy recommendation. Then there is a national sustainable development strategy, again mentioning gender very clearly in it, and also establishing the linkages for SDG6 reporting as well. Then Pakistan had hygiene for all roadmap that is developed in 2021, and it's still 2030, but it is again reflecting the gender context within this framework. And then Clean Green Pakistan movement, which is one of the flagship initiative of Prime Minister of Pakistan, again reflecting upon the 9 major pillars, and one of the pillar is reflecting upon the gender and inclusivity for the WASH related services, as well as the infrastructure as well. Services, infrastructure, and accessibility, from accessibility point of view. Can you move to next slide? So when I mentioned these documents, so these documents actually are to be transformed into reality, for which government of Pakistan, they have strived effortlessly to actually mobilize some of the resources to achieve the gender reporting targets as well. So National Climate Change Gender Action Plan was supported by GCF, and this currently this support is available in Pakistan to actually report on climate change and gender context. But when we are talking about climate change and gender, WASH is one of the major area which is to be reported as far as the gender reporting is concerned. Then NDCs, again, national determined contributions. This document has been revised, and it also has incorporated core area for youth and women in greater climate actions as well. So now currently at this point in time, we are preparing the implementation plans for NDCs, which will definitely take this policy recommendation into action. Please move to next slide. The green stimulus package, again under green stimulus package, we have identified multiple sectors which include fisheries, forestry, agriculture, orchard, horticulture, ecotourism, wildlife area. But going beyond it also has a WASH component within it, under which we have created almost 52,000 jobs for the green jobs for the communities, which 50% of the coverage has been given to women under that package as well. Please move to next slide. Then there are few entities that are existing at the national level, which are actually as well as the provincial level, and which are also supporting the SDG component for SDG6 as well. So National Commission on the Status of Women, this is a statutory body that was established in 2000, and it has both national and provincial offices. And this commission is working on the and is the lead agency to mainstream gender components. Please move to next slide. Now, beyond these policies that are available, we have also developed the policy guidelines. Why policy guidelines were developed? They were developed just to update the policies and policy instrument for the better dissemination of policy instrument into provinces as well, and to address the immediate and to transform the policy recommendations into action. So policy guidelines were developed, again reflecting very clearly on the gender components. Can you move to next slide? Clean Green Pakistan movement, I have already mentioned that this has the 9 pillars, and one of the core pillar is this gender and inclusivity as well. And if you see that the pillars, the major pillars under this are safety, access to safe drinking water, solid waste management, liquid waste management, hygiene, plantation, and total sanitation. Please move to next slide. Then there are few initiatives that are going on with other ministries as well, like Education Ministry. Water Aid is working on some of the initiatives, and then another unit was established at the national level, which is the WASH unit within Ministry of Climate Change, that was with the mandate to report on SDGs. So these move to next slide. Again, water quality is another area which is again prioritized within at the national level as well, and it has the gender component within this water quality reporting framework as well. Please next slide. Yeah. So yes, you can shift to next slide as well, Nicole. Next slide. So Nicole, these are on the last two slides. I've just taken up few of the various interventions beyond SDG6, which are being established at the national level, actually to mainstream gender components within it. I've given you a very brief, holistic picture that what is here at the national level as far as policies, strategies, and plans are concerned, and what are the key or major projects that are on ground that are addressing the gender component. But what I would like to say is that this is not the complete picture. There are major gaps and challenges that we are currently facing. So one of the major challenge is that yes, as in government, we do understand and we do realize and we have the policy backing that gender is one of the important component, or inclusivity is one of the important area that needs to be addressed when you are designing a project, when you are implementing a project. But the problem is that we do not have the answer for the how section, because how changes everywhere. We being at the national level now, looking at the different geographical locations or the different cultural context, the question of how we are going to mainstream it, how we are transforming into action is a bit very complicated and complex issue. And we still are trying to find out the answers, and every answer is not every question does not have the same answer, and every solution is not, the solutions are not fitting, one solution is not fitting into every situation. So this is one of the bigger challenge when we are actually working on the gender context. As far as reporting is concerned, yes, we do establish the baselines for the SDG 6. We have the costed plans, but we are unable to mention very clearly that how much of the costing will go directly into inclusion or into gender context as well. We have one of the ticking the box checklist that yes, gender needs to be part of the project plan. It should be part of the implementation framework, but this is as so far as a checklist it's there. When we are going to report back, we do count in numbers, but what actual actions need to be there for efficiency, for action on ground, for the impacts and the outcomes related to gender, they are still missing. So it's a long chain which has multiple missing linkages that are existing at the country level. But we are at a stage where there are a lot of steps that are to be taken up to reach to a certain level where we are actually reporting gender, where we are taking actions and interventions that are actually transforming these actions, these policy recommendations into actual actions. So this is kind of a reflection as far as SDG 6 and gender is concerned.
Good evening, everyone, whoever joining from anywhere. So it was very great to hear all of you. Both of the presentation was very insightful. So as a young professional in work sector, I would like to share some of my experience. So I have joined BRAC as a young professional, and BRAC is #1 NGO and the biggest NGO in Bangladesh and all over the world. So it has multi-sectoral fields where BRAC is working, and WASH is one of the tiny component of this organization. So in this young professional program, I actually got to learn about all of the programs, all of the departments and enterprises BRAC own, and got to know that how all the things BRAC doing are impacting the grassroots level people. So after my, as I'm a public health graduate, so I was really keen to work under the health program. And then I got the chance to work with WASH program. That was really eye-opening, because to be frank, as a student, I haven't thought of working in WASH field. But when I started working, I thought that this is really very a crucial field where we can work to upgrade the public health features of our community people and all of us. And WASH is very, very important to have a good health and also financial liberation. So I started working with WASH, and I got to know that there are different components. We are working with rural people, urban people. We're working in schools, especially where we can actually advocate for menstrual hygiene management among the girls students. So this was, so far, it was my amazing experience. And I'm very glad that I'm still working with WASH program, and in future I would love to work in this field. Now, reflecting with the first presentation, so when I was listening to the presentation, I realized that yes, we are lacking. As an organization, BRAC always put girls and women in the first place. Whenever we are designing any intervention, we do think from the gender frame that how we can uphold the lives of girls and women. So whenever we are designing any WASH intervention, we do prioritize their needs, their choices. And as far I know that whenever we are providing any WASH facilities in the household level or in schools, we always think about the dignity, the accessibility, and the availability of the facilities in terms of girls and women's perspective. So we always try to make the facilities inclusive, disabled friendly, and female friendly. But if I think about that, if we are measuring the impact or the empowerment, we are not. So I would really love to incorporate these tools, as I got to know now in with my program, with my colleagues, that this is one thing we should do, because we are doing it, but we don't know how much we are achieving. Without measurement, we cannot do that. So that's one important thing. Also, in my last 3 years, I'm working in WASH sector. I feel that as an organization, BRAC is like a bit lacking on research and impact evaluation. So whenever we're getting funds and anything, we actually focus on the infrastructures and other facilities we can give. Maybe we are not allocating enough budget for the research or impact evaluation. So this is what we need to work on. And I know that research is a multi-sectoral field where we can incorporate knowledge partners, other NGOs also, so that also universities like Emory University colleagues are here presenting. So this is one thing we should enforce from now on more in bigger scale, so that we actually can capture all the impact of our intervention, so that we are not creating any knowledge gap in future. And also, as Ms. Saima presented, Bangladesh also have a lot of policies in places how to achieve SDG goals. But again, I think that this the written things are not really that helpful in practical field. So we have to be very, very active regarding implementing all these policies in our field level, in the community level, so that whatever we are saying, those are reflected in the real lives of the people. So that was all I wanted to say. Thank you so much for having me here. And yeah, I would love to hear more from you all.
Thanks, Nicole, for generous introduction. Just to reiterate that we are at this juncture on Monday. Actually, the IPCC's Working Group 2 report, which has been just out, and the report actually focuses on impact, adaptation, and vulnerability. And I have been fortunate to be coordinating a cross-chapter box on gender and climate change. And there are many, findings which, in fact, the global assessment, we have about 35 gender researchers who work with us, and we've come to a very interesting assessment on gender and climate change globally. And I'll tell you what the implications of this on India. I essentially started my career with the WASH researcher and moved to climate change, and gender is what my forte is. And I was looking at how, WASH sector, how much of that is impacted by climate change. And if you look at the geography, if South Asia geography, for example, we essentially worked in about 8 countries, including Pakistan, Bangladesh, Sri Lanka, Nepal have stayed there. What we have seen is there are 4 types of stressor that climate change is going to bring, and each one of them actually will be having impact on the WASH sector, because we have to look at the sector from a larger perspective when it comes to gender and climate change issue. So I'll tell you, first is definitely the sector which is impacted is the agriculture production process. So the declining of agricultural production, the way in which climate variability is panning out, that is actually bringing in women's labor. So women actually have to work a lot more because the productivity is going down. Men are migrating. Men are migrating out to the nearest cities and towns. The burden of economy is on women. That's number one. Second is the related factor is about declining food security. And that decreased food security means decreased consumption by women and girls, because as you know, the structural inequality that we have in the house, especially in the South Asian conditions, this leads to differential consumption patterns for women and girls versus men and boys. And that is something that is impacting on women's health. So we're looking at water, sanitation, and hygiene. All that is important for us to look at. And third point is about changes in the water availabilities. The water regimes are changing very fast. And within that, the traditional role of women, looking at how the collectors of water in the house, a household, that is bringing a lot of stress for women. If you look at the situation, if you have a drought condition or if you have flood conditions, each of these conditions bringing in special stress on the water infrastructure, sanitation infrastructure, and this is also leading to women being much more stressed. The fourth and the last point is about conflict and migration. I've already spoken about how water insecurity is actually, and migrations also interlinked. People are seeing that the variability in climate leading to less production, leading again to men being migrating out because they have to then survive, and women become the major person in the household or the economy, and she has to do sometimes double or triple shift to maintain the household economy, as well as the problems that it comes with. So wash sector has to, all these years what I've seen that wash sector has been looking very inward. They are inward looking people. They need to really see the outward part of it, how each other sectors are interlinked, interconnected, and probably then devise our strategies. And I'll tell you one or two problems which comes. For example, the water infrastructure has to be very strongly supported by climate resilient projections. Climate resilient infrastructure has to come in. The sanitation infrastructure, and I've seen work in very extensively in the north Bihar area, which was actually collected with rivers in Nepal. What we found is that the rivers are being flooded, and the conditions of the floods are increasing much more, including the frequency of floods. That means 4 to 5 months, the wash infrastructure is totally drowned in the water areas. Where do women go? And unfortunately, what I've found that the women defecate or men defecate in the same water, drink the same water, because they have no other place. There's everything is drowned. And they have no other place to go because the area is very thickly populated. So that's the whole part of it. So how do I design a wash interventions in those areas? Look at the drought conditions. If we have a wash infrastructure, when the severe drought occurs, people don't have enough water to drink. Do you think that they will be using hygienic behavior because of certain things? So this is the things. And the new report, which I'm part of, is telling us that the severity of these will be increasing manyfold. And that means we have to tune in for our strategies of how do we look at it. I will end this with 5 points that we have. The first point I would like to tell you is that the differential vulnerability, we all know that this is, and in fact, I was glad to see the presentations have actually looked at women's agency and women's empowerment issues. We also know that there are differential vulnerabilities. Women also, there are class, caste, age, those differentials are there, children, transgender people. So don't only look at women as women, but also understand that women also, there are different categories of men and women. And that means when you're designing a program, you need to take that differential vulnerabilities into account. That's point number one. Point number two is that we also have to see whether the climate change policies are in tune with the gender inequity sensitivity or not. And I'll give you one example. We did this global research as part of IPCC. We looked at 4,000 adaptation programs across the world, and about 9 sectors, and see how we wanted to see how this is aligning with the SDG6, which is gender equality and women's empowerment. We found that out of 9 sectors, 4 sectors actually are negatively impacting women's life. And some of them are, the mountain sectors, the coastal infrastructure, the terrestrial infrastructures. These are the areas where adaptation programs are climate insensitive. What one is trying to see is that, how if you're designing a water infrastructure as adaptation to a climate change program, you need to understand how this could be gender and both equity sensitive. And that is where I would like to put the second point. The third point is that the livelihood systems are changing very drastically. The external environment and the climate is becoming much more stressed for women. And that means that the climate change hotspot regions have implications which are very, very gendered in nature. You look at Bangladesh, for example, and I know Suhana is working very extensively. Look at the flood conditions in Bangladesh. You have, sea level rise in the southern part of Bangladesh, and the areas. You look at Pakistan. My friend is from Pakistan. The coastal areas as well as the northern areas in Pakistan, India. You have all these kind of ecologies. So each of these ecologies are in South Asia are getting more and more stressed. Livelihood systems are becoming very much stressed. So we need to definitely devise ways in which we cope with this thing. So our adaptation program for WASH has to tune into that one. The fourth point is about the solutions, which is gender transformative. So it's enough that we are talking about problem. What is the solution? And in fact, the IPCC report this time is very unequivocally focusing on what could be the solutions. And there are some which probably you can go and read. There are interesting solutions which are there, but I'll just highlight one, which is how do we look at what we call the gender transformative approaches to WASH sector. And what is gender transformative approaches? It actually challenges the inequalities and moves beyond what we call the instrumentalist approach to gender and development interventions. That means that we really have to break away from the general ways in which we are looking at gender within the water sector, and to understand that how each of our interventions could be transformative in nature. That's number 4. Last point, I will actually tell you about the north-south divide in research. And this is the point that I was trying to bring forward, that you have people in one location are used as research associates, and somebody sitting in some other locations are actually theorizing on those research. This dichotomy has to end. I think there are enough resources in this region. There are enough research in the region. I know the resources are not there, and there is a structural inequalities in which resources are distributed. But I want people who are listening to me here to pay much more attention to not accept anything which is just coming, as extrapolation of what you've done, right? So you have to take charge of your narrative. Nobody else should be actually building narrative for you. That is the last point I want to end up with. Thank you so much. Over to you.